Dr. Ray Marquez here, local chiropractor, Back Pain Relief Center. We're here with Rose today, and Rose has a little bit of a back issue. She fell off a horse a few years ago, and she went through some therapy, and she felt better, but now she's telling us that it's been bothering her a little bit in the mornings. Like a lot of people, it hurts when you wake up, and then kind of gets better throughout the day. So we're thinking she might have a little bit of compression of some of her lumbar joints. Since she's here, we're going to adjust everything, try to loosen it all up, and try to get her to function and feel just a little better. All right, so can I take those glasses from you?
Yep.
And we're going to have you go face down, so you're going to lay on your belly. So face here, and your hands are kind of just hang on the sides. And just like that. All right, so the first thing we're going to do, and we already did an exam on Rose, and I have a good idea what's going on. We're going to loosen her back muscles up. So I'm going to bend her leg, and what I'm doing is I'm putting pressure. Rose, I'm putting pressure on your back muscles, and we're just going to try to loosen them up a little bit by moving your leg in and out. If it feels like it's going to cramp or your knee bothers you, tell me. Already moved a little bit there, huh? Okay, and we're just loosening those muscles up, so when we go for the manipulation, it just holds a little better and moves a little easier. We're going to move on over to the other side. Loosen those muscles up for you. And back. Next thing we're going to do, we're going to use an adjusting instrument on Rose. And the adjusting instrument breaks up any adhesions and scar tissue that form through chronic dysfunction. So when we use our backs abnormally over time, you build up adhesions in the joints. It could be little tender, Rose, I'm sorry. And those adhesions restrict range of motion. Put your head up there a little bit. Rose is also a student. Sometimes sitting for long hours can affect that back. Next thing we're going to do, we're going to loosen up the back muscles just a little more. This allows for a better adjustment, gets your body to relax a little bit. All right, you want you to lay on your side, face me. All right, so this next thing we're going to do is a lumbar adjustment or low back adjustment. Okay, I'm going to kind of put you where I need you. I'm going to bend your top leg. Okay, so here's your low back. We're just going to, real easy. That's all it was. You okay? Yeah. Let's do the other side. Come on around. So what happens is, these low back joints can get dysfunctional, and when they're dysfunctional, they put pressure or they compress or load the joint. What we're doing with the manipulation is just unloading or decompressing that joint. Okay, bring it a little closer to me. Okay, same thing. Good, you okay? Let's go on your back for me, face up. All right, so when patients come to see us, sometimes all they have is a low back problem, and we're just going to treat the low back. But with Rose, since we had a fall on a horse, we're going to just check everything just to make sure that it all works right and we don't have any compression somewhere she doesn't know about. When we adjust patients' neck, about half of my patients love it, the other half hate it. And the people that hate it, it's not because it ever hurts, it's just the noise. So if it's something that bothers you, just let us know. Same thing, Rose. If it bothers you, let me know. Okay? Gonna move that earring. So it's going to come on over nice and light. Good. Nice and light. Good. Wasn't too bad, right?
No.
Lots of noise there.
Yeah.
Come on up for me. Let's sit on the edge of the table, face this way. So our last adjustment, we're going to adjust through here, your mid-back. Okay? So we're going to cross one arm, cross the other, chin down. It's going to lay you back. Keep your chin down for me. Good. One more time. Good. There you go. That's your first adjustment.
Oh, great.
All right, guys. Hey, thanks for watching. If you have any concerns or comments or questions, please respond to this post. If not, you can always email us or just walk on in and I'll talk to you. All right, have a great day. Thanks for watching.